At the core of the webinar is the topic, which is to empower nursing and expectant mothers with nutrition and breastfeeding insights that are essential not just for themselves but also for their babies. I have our facilitators here who's going to be doing justice to the topic in view, and I'll introduce them very quickly and then we'll begin the session. So I have with me here Mrs. Amarachi Igboanugo. She's a dietitian and clinical nutritionist. And also I have with me here Sanusi. This is Sanusi Oluwaseun. She's a pediatric nurse here at Lilly Hospitals Limited. Each of them are going to be taking us on a quick session, and I would like for every one of you who are present here to prepare your questions because they are going to be attending to them as soon as they are done with their sessions. Thank you once again for joining us. Right away, we will begin the webinar. Thank you. Please, if you're joining in now, kindly mute your mics and then your video to allow for a stronger reception. Thank you so much. Thank you. So quickly, we would have Mrs. Sanusi Oluwaseun begin the session right away. Thank you. Mrs. Oluwaseun, please can we have you begin the session? Thank you.
Okay. Good day, everyone. My name is Sanusi Oluwaseun from Paediatric Unit Lilly Hospital. We'll be talking on the webinar which is nutrition and breastfeeding, empowering nursing mom with essential nutrition and breastfeeding insight. Here we'll talk about the content of our today's webinar. As we can we all see the screen? Okay, thank you very much. We'll talk about the intro, the definition, why breastfeed, that is the importance, the components, the types of breast milk, how to breastfeed, just with the position of breastfeeding, the storage of breast milk, and we also talk about comments about the breastfeeding and advice for mothers. To begin, recently we had World Breastfeeding Week, which was from August 1st to 7th of August this year, and the theme was set by the World Alliance for Breastfeeding.
So the person about the license.
For this year on, we want to enlighten us about enabling breastfeeding to make a difference for working parents. The above things make the pillar of our presentation today, which is very important because workplace is one of the challenges that remain the most factor and not enable women to breastfeed their children according to WHO standard. And also it will enable parents need adequate time to support breastfeeding. Parents need adequate time and support to breastfeed. Parents with less than 3 months of maternity leave will reported shorter breastfeeding duration than those with more because they resume earlier, which might cause the challenges for them to breastfeed their child. And also the workplace may be a friendly area to welcome so that there will be a breastfeeding friendly workplace for them. And also to protecting, promoting, and support breastfeeding, addressing inequality that stand in the way of sustainable development. So now we'll start about the definition of breastfeeding. According to WHO, breastfeeding or nursing is the process by which breast milk is fed to a child. Breast milk may be from the breast directly or may be pumped out and to be fed to the infant. The World Health Organization recommends that breastfeeding within first hour of a baby's life and continues as often as much as baby wants it. All health organizations approve that, including WHO. They recommend exclusive breastfeeding for 6 months. So what if we are talking about exclusive breastfeeding for 6 months, what does that mean? It means that there are no other food or drinks or thing that will be given to the child apart from breast milk but prescribed medication and vitamins might be given, which must be medically prescribed during that period. So the WHO recommend exclusive breastfeeding for first 6 months of life, followed by continued breastfeeding the infant with appropriate complementary feed after 6 months for up to 2 years of life. So why do we need to breastfeed our baby? What are the importance? What are the benefits that we gain from breastfeeding? It contains and supply all the necessary nutrients in the proper proportion that the child needs for his developmental growth. And also it protects against allergies, sickness, and obesities. It also protects the infant from against chronic disease that might later come up in life, like diabetes and cancer, so on. It also protects against infections like ear infection, and breast milk is easily digested. There is no cause for constipation or diarrhea or something like upset of stomach that can occur. It's easily is prepared for the child. Also, we found out that research has shown that children or babies that are well breastfed will have a high score in intellectual test, which is IQ. It boosts their brain power. Also, it is ready and portable. Breast milk is always fresh and exactly the right temperature. It is also with the mother. When it's time that the child needs it, the mother is ready to breastfeed the baby. Also, baby have earlier weight as they grow, not like giving other maybe complementary feed as at early age that might prone to the child of having excess weight gain. But breast milk give baby the early weight they need to grow. It also provides passive immunity from the mother to the baby. Through breast milk, there are some enzymes almost that passed from the mother to the baby, which help them to build up their immune system to fight against infections. Also to the mother, good for the mother because research shows that while breastfeeding can protect the mother from many diseases such as breast, ovarian cancer, and also it's also during breastfeeding it brings or build up bonds between the mother and the baby. The closeness and the comfort that occurs during breastfeeding helps the mother and baby to bond together, which can also reduce the cause of postpartum depression after birth. It also helps to prevent or reduce pregnancy. As you are lactating, breastfeeding your child, there are some hormones that will be released that will help to inhibit the ovulation process during that time. Thereby, you will not have pregnancy while you are breastfeeding your child. It reduces the chances. Also, it also helps in the evolution of the uterus. When after birth, the uterus has to go back to original state. While breastfeeding, it helps with the contraction so that the uterus can go back to its pre-pregnancy stage. Also, is always at the right temperature, already their baby, and it doesn't require any form of preparation. And also, it's environmental friendly, available, and also it also reduce budgets. It save money, save costs, because you won't be spending money on buying any other complementary feed or formula from outside. It is there. It saves the cost from the parent, the family also. All right, what are the components of breast milk? Breast milk primarily composed of water, carbohydrates, and lipids and protein. Each of these nutrients, they play a vital role in contributing to infant growth and development. Water itself, human breast milk is made up of about 90% of water. The human body depends on water to function properly, which help us to maintain rehydration, regulate body temperature, lubricate joints, and also protect all organs. The carbohydrates then in the breast milk give them energy, it's a source of energy for the brain and also the main carbohydrate in breast milk is lactose because we call it milk sugar, which is about 7.1% of the breast milk. And also other carbohydrates found in breast milk is the oligosaccharides, which majorly promote healthy bacteria, which helps to maintain the baby's intestine. Also, we have the lipids, which is the fat. is made up of about 4 to 4.5% of the breast milk. They provide over half of the calorie that the baby needs to receive as a source of energy. And lipids are a major source of energy during that time. The cholesterol and essential fatty acids such as DHA provide necessary nutrients for the baby developmental age. That is, their brain, their nervous system, and their vision will be well developed if given to them. Also, it contains proteins which build and strengthen and repair body tissue. As we know, they are also needed to make hormones. They are also needed to make hormones, enzymes, and antibiotics. Breast milk contains about 0.8 to 0.9% and is essential for babies to digest. And these proteins are essential throughout every stage of life cycle of woman to survive, because our body needs the strength. When tissues are dying, they need to be repaired and bring back. So protein is very essential, which is found in the breast milk, which makes breast milk more important. It will now lead us to type of breast milk. We have like 3 different and distinct stages of breast milk. We have the colostrum, the transitional milk, and the matured milk. The colostrum is the first stage of breast milk, occurs during pregnancy and lasts for several days after the birth of the baby. It is either yellowish or creamy in color, and it is much thicker, very thick than the milk that is produced later in pregnancy. It's always thick, very creamy. So the colostrum is very high in protein, fat, vitamins, and minerals with immunoglobulin. The immunoglobulin is the antibiotic that pass from the mother to the baby that provide passive immunity for the baby. This immunity being passed protect the baby from a wide varieties of bacteria, viral illnesses. And this milk takes like 2 to 4 days after birth, which will now be replaced by the transitional milk. And the transitional milk contains high level of fat, lactose, and water-soluble vitamins. It contains more of calories than that of the colostrum. Then after that, it lasts about like approximately 2 weeks. After that, the mature milk will now take over, which is the final milk that is being produced. It contains 90% of water, which is necessary to keep the infant hydrated. Others are now 10% of the carbohydrates, fats, which are necessary for the growth and energy of the child. Also, the matured milk, we have like 2 types of the matured milk, which is the fore milk and the in milk. The fore milk is a type of milk that is found during pregnancy, during the beginning of feeding, and contains water, vitamins, and protein. Those are the first milk coming out from the breast when the child is breastfed. Then the in milk will come after the fore milk, which is a type of milk occur after the initial release of the milk. This one contains high level of fat, which is necessary for weight gain. During breastfeeding, we encourage mothers to give breast to baby like 15 to 30 minutes so that the baby can have a good grip of the both the milk and egg milk, so that the baby will make use of the milk coming out of the breast. Now we'll talk about how to during breastfeeding. Because we found out that some mothers find it difficult to sit well. They say that their back is paining them, they have issue, cracked nipple or so. This occur due to bad position during breastfeeding. If you position very well, you won't have all those things during breastfeeding. There's a picture showing a mother sitting very well during breastfeeding. So the pictures will show how to breastfeed. We have challenges during breastfeeding. While breastfeeding, if you are sitting on a chair or a chair, you have to sit very comfortably. Make sure your back is resting properly. You are sitting very well. Then you carry your baby to yourself, skin to skin. The head of the baby will be between the elbow. If you are using your right hand or your left hand, will be between the two, your elbow that you want to use. Then the hand and your back of your palm will be at the back of the baby, which will make the edge of the baby and the bottom align, so that your hand will be at the back of the baby's buttocks, as you can see from this picture now. And the other hand can use to support the baby. You can get a pillow. We have breastfeeding pillow that can help you to carry the weight of the baby to assist you during breastfeeding. You can see the head of the baby is tilted backward a little bit, so that the baby can latch on both the nipple and the areola. Because if the baby is not positioned well, the baby will really latch on the nipple, which can cause sore nipple or cracked nipple. But if the baby is positioned well, you'll be able to latch on both the nipple and the areola, which will make breastfeeding very effective. If you have a twin, you'll be wondering, how will you breastfeed your twin baby? You can see the picture to also showing how we breastfeed our baby very well. You can see the twin now. They are both the nipple and the areola is in the baby's mouth, and they are sucking very well. The mother is holding them very well. That you can see that their nose is not covered by the breast. So we have to watch that while breastfeeding, so we not suffocate our baby, so that they can feed well. With this same position, the screen I'm showing now, the baby will be able to feed very well. There will not be any fear of sore of that nipple while breastfeeding. So mother has to feed properly, and it has to be baby to breast, not breast to baby. If you are taking breast to baby, you'll be straining your back, which can cause back pain. So why is breast to baby well positioned? We are according to that first picture. You'll be able to breastfeed your baby very well, very comfortable. There will not be issue of back pain and stress with baby. So we talked about storage of breast milk, because some mothers might have challenges. Maybe they want to go out, they want to get something, or they are busy, or maybe when they resume at work, how to do breast milk storage so that they can breastfeed their baby. Breast milk can stay in room temperature within 4 hours of expressed out, and you can keep inside fridge for like 4 days with uninterrupted light. Then you can store your breast milk as long as 6 months to a year in a freezer, which shows that we can actually keep our breast milk in order to achieve, according to WHO, the exclusive breast for the first 6 months of life. So we have some challenges. This picture shows different types of nipple that few mothers have. I'll be talking about the inverted nipple, because this causes challenges to mothers that have it as their baby latching well on the nipple, because the nipple is inverted, go inward, not outward like all others when I see that are pointed there. So that one, there is a solution for it. If a mother has a inverted nipple, the next picture shows how to bring it out so that the nipple will be pointed. During pregnancy, the mother can do what cause stimulation using her hand to try to be dragging the nipple out throughout the pregnancy, so that before the baby is out, the nipple is inside. And if all those one fails, there's a picture here showing how the nipple can be extracted out. We have a syringe there. The front end of the syringe will be cut and smoothened so that it won't cause any damage. You can also place the rubber band to apply to the vagina so that it will not cause any crack or any injury to the breast. So that we'll put the cut part of the syringe to the nipple area, and try to use the syringe to suck out the nipple into the syringe. When it's sucked out, we can see now that the next picture has shown where the nipple is coming out. Then the last one shows where the nipple is out, and you apply the rubber band at the base in order of the tube so that it will be prompted out so that the baby can suck. When you do that, the nipple will not go back again. It will not be there so that the baby can suck out of the milk from the breast. So we have some myths about breastfeeding, because number one is if you have a small breast, you cannot produce enough milk for your baby. It's not true. The breast size is caused by the amount of fatty and fibrous tissue in addition to the amount of the milk producing granular tissues. The milk producing tissues is the same thing with big breast or small breast, relatively the same thing. So what make the breast size different is just the fatty and the fibrous tissues that are there. So, and secondly, the breast milk production is hormonal stimulated and increasing with baby's demand. So those are the things that are essential for milk production. So it's very clear that the baby is in control of the amount of breast of the milk that is being produced. The size doesn't matter at all. So the more you put your baby to breast, the more milk flow because of the hormones stimulation. And also the second way that babies who have been breastfed will be claiming that they will be so much attached to their mothers. Is not so. All babies are different. Some babies that are well breastfed, they won't be so attached to their mother like that, and the ones that are not breastfed might still be attached to their mother. So it is not part of it because it's the importance of the breast milk that we know that it's only best for the baby as the best nutrition. So it's also important for their development times of their brain. So we need it so that babies can grow well. The only thing that is enhanced bonding with their mother, not all this special clinging with the mother. And also that another third myth is that you can't breastfeed if the size and shape of your nipple is not perfect. As I've shown you earlier about the inverted nipple, so that because your nipple is inverted, because the shape of your nipple is too big, it's too small, you can't breastfeed. No, because every man has different size and shape of breast and nipple. There is no any perfect breast for breastfeeding. It is God's gift. So the other factor consider is that every baby is different in their size of their mouth and the lips and tongue, and also the anatomical compatibility with the mother and the baby is what makes for a better breastfeeding experience. The baby has a lip, whether it's small or big, or the nipple big or small. We try to encourage them good positioning and training and enlightenment and education on the mother will help to achieve a good breastfeeding experience. And also, fourth method is usually for breastfeeding to hot due to sore nipple that are inevitable. Though mothers do experience discomfort in the first days, few days after birth when they are learning to breastfeed. But with the right support with positioning, as we discussed earlier, during breastfeeding their baby and making sure that baby is correctly attached to the breast, the sore nipple or cracked nipple will be avoided. And if the mother is facing breastfeeding challenges like the sore nipple, the lactating consultant or the nurses in charge or with professional skills in that area can help the mother to overcome the issue that is facing. We've come to the concluding part of this breastfeeding, the importance, the benefit, and so on. So in summary, breast milk is the best food for infants, which helps in the developmental growth of a baby. So we are encouraging mothers to try to comply with the WHO standard of breastfeeding so that we can achieve a healthy infant. So thank you for your time. So Mrs. Amarachi now will come over to speak more on the nutritional parts of the breast milk.
Thank you so much. Hello, everyone. Thank you so much, Mrs. Sanusi Oluwaseun, our pediatric nurse here at Lily Hospitals Limited. That was quite an expository time. I want to thank everyone who is holding the fort. We are going to be interacting on the matter talked about. Please hold on, give us your ears. What we're passing on to you is important for the baby and then for the mother. So very quickly, we're going to have our second speaker for today on the topic, the person of Mrs. Amarachi Igboanugo. She's a dietitian and a clinical nutritionist here at Lily Hospitals Limited. She's going to take us further on the subject. Please give her your time. When she's done, we're going to be interacting. We're going to be taking questions. We're going to be attending to the questions that have been sent in earlier for this session. Thank you so much once again for your time. Mrs. Amarachi, please can we have you now for your time? Thank you.
Okay, good day, everyone. My name is Amarachi Igboanugo. I'm dietitian and clinical nutritionist in Lily Hospital Limited. And I'll be taking more of the nutrition aspect of this webinar. So the aim of this is to empower nursing moms with essential nutrition and breastfeeding insights. My colleague has done well with the breastfeeding parts, and I'll throw more insights on nutrition. Nutrition starting from the first day of life till the early childhood. Okay, first, the 1,000 days of life of a child is full of expectation. As parents, as mom, we expect some developmental stages, and nutrition has a very important role to play at that level. So I will scan through different developmental stages that is expected of Okay, sorry for the interruption. I started from the first 1,000 days of life. That is very key in child development. So infants and young child feeding is very, very important because it has a very important role to play in terms of development of the child. So the first model, we go through the developmental miles of a child. So from 0 to 3 years, we have this developmental journey. You can see the first picture that from 0 to 6 months, we expect the child to still be crawling. 6 to 12 months, the child would have started making some moves and walking. From 12 to 24 months, child would have started walking around, and this continues and continues. Then we have some developmental milestone that is expected. The first one is the physical growth. Every mom expects the child to grow physically. As you're looking at your child, you can say, yes, my baby is growing. and we expect changes in body composition, brain development, the immunity of the child, the gastrointestinal development, and some important nutrients. So we'll go through each of them. For physical growth, it covers both the weight, height, and it's very important. We introduce growth monitoring, which if a mother is visiting proper immunization centers, they monitor the growth of the child during the immunization. Then for physical growth, we expect the weight of the child to double at 6 months, and by 9 months it triples, and it continues that way on and on and on. The same with the height of a child. The height of a child keep increasing at birth. Then in the next 6 months, we expect about half of the increment to the child, and it continues that way. And for body composition, it covers fat tissues, muscles, and bone mass. So the child starts developing this, and we see it more in boys. Boys develop higher body mass than girls most times. But all these things, they are all milestones that is expected. And for every mom, these are the things they watch out for. So even the body protein during the first year of life is also expected as the child is aging. So a higher peak reduces the risk of osteoporosis later in life. So when the bone of a child develops at higher range, it reduces the risk of osteoporosis. Now, this osteoporosis is the common thing. Some people, the common name, our moms call it, they'll tell you they're having arthritis and all of that. But if the research has shown that if a child develops the bone as is expected, a higher peak at this early stage of life help to reduce the risk of this osteoporosis later in life. Then for brain development, it covers the brain development before and after birth. So the right nutrition and stimulation can help make the most out of our genetic potential. So at times there are some families that you might say they are not usually brilliant, or they are more brilliant than the other. But if the right nutrition is given to this child, we can have this brain development. We can give a better age for this brain development. So by 2 years, the brain weighs between 1.04 and 1.2 kg, and will have reached around 80% of its adult size of 1.2 to 1.5 kg. So that's why good nutrition is very important at this early stage. So between infancy till 2 years, we expect a proper nutrition so that the brain will be properly developed. Because at this stage, you see some brain development connecting to the sight and hearing of the child, language and speech, the cognitive functions of the child, and all these things help and give confidence and hope for the mothers. And we have also the immunity, which the first presenter has thrown some light on. First, breast milk, which is the colostrum that gives this immunity and other benefits. So this immunity, we have different types. We have the innate one, which begins from the womb. We have the passive one, which is a short-term immunity that is passed from the child. For example, through gestation, labeling, antibiotics in breast milk and others. Then we have acquired one too, immunity which develops over time due to response. So we also have some nutrients that are key to this immunity. We have vitamins like vitamin A, C, E, as well as zinc to help us build the immunity of the child. Then for the gastrointestinal development, it covers the main digestive system of the child. So all these things they are developing. Now, a child gastrointestinal microflora matures over time. So when you give birth to a child, the child microflora, which are the microorganisms in the GI tract, they will start maturing as time progresses. We also see development in gastric capacity. So even the stomach size of the child starts increasing as the child is growing. Now we have some important nutrients that is needed. So the key nutrients for growth and development include iron, iodine, zinc, B complex, vitamin D, C, calcium, magnesium, phosphorus. Now we'll talk more on some diet that will give us this at this stage of life. Now, children have higher nutritional needs than adults due to rapid growth. So you can see the comparison that the vitamin A requirement of a child is about 5 times more than the one for adults. The same with iron, about 4 times more, zinc 3.9 more, phosphorus 1.4 more, and energy 2.5 more. And you begin to imagine, is it this small size of the stomach that will take all these things? That's why moms need to pay much attention to the diets and the nutrition of their children. Now we'll go to the nutrition proper. This will take us through breastfeeding, infant formulas, and complementary feeding. Breastfeeding, I'll just scan through because my colleague, the first presenter, have done justice to it. Breastfeeding is actually, it comes with unique composition, and you can see it going from colostrum to mature milk, and it has a lot of benefit to both the mother and the child. She has cited so many of these benefits. So breast milk is unique, extremely complex, and impossible to duplicate. A lot of people can tell you they're using so formula, is good for this, is good for that. No matter how good the formula is, it can never duplicate breast milk. There have never been any. So there is need for mothers to properly breastfeed their child as expected. So the colostrum is the first breast milk you see that flows 0 to 3 days after childbirth. We have transitional milk, which flows from 3 to 10 days, and we have the mature milk, which comes from 10 days. So I'll just count through this because I know she has said a lot about the breast milk and the benefit for both the mother and the child. But we need to understand this, that peradventure we are introducing a formula after exclusive breastfeeding, maybe to be adding it to the breastfeeding. There is need for us to go for the appropriate one. Now, WHO recommends that when breast milk is not available, only an age-appropriate infant formula should be used. So we have infant formulas with their different age recommended for each one. We have starter formulas, we have follow-up formulas, we have growing up. So starter formulas, they usually use it from 0 to 6 months. And follow-up formulas, you see the one from 6 months, and growing up is 6 from 12. I know some of these companies, they have tried to make it to provide some nutrients that the child needs at that age. And actually, intake of milk is very, very important for the growing child. But when a mother is choosing a milk or a formula, she should use the one that is appropriate for the child's age. Now we have some inappropriate breast milk substitute. Some mothers give some different reasons why they can't get the right milk for the child. Now you see some of them introducing whole cow milk, which is normal adult milk for the child. Some use evaporated or sweetened condensed milk. Some use cassava flour, use rice glue, some sugar teas, fruit juices, dextrose water. But these things are inappropriate and should not be used. It's need for us to use the appropriate infant formula for the age of the child. So why not unmodified cow milk? When we say the child doesn't need cow milk at that age, you use the formula that is appropriate for the child's age. We have some of these disadvantages that they are not suitable for the immature kidneys of the child because they are so much high in protein, sodium chloride, which the kidney of the child is still developing. So that will not give good edge for the kidney development of that child. Then we have not adequate. Most of these, they have too little essential fatty acid. Now, when we say essential fatty acid, these are the fatty acid that is very, very essential for the child. We know the one for adults and child, we always have one that is lacking for adult and is very, very necessary for the child. So the cow's milk will not provide the essential fatty acid for these children. Now, they also have too little vitamin C and E. It's also not suitable for the immature intestinal tract. So when you have too much phosphorus coming in, the intestinal tract of the child is still developing. So when we have too much phosphorus, which is present in cow's milk coming in at once, it becomes a problem for the intestinal tract of the child. It also have lower fat digestibilities and reduces energy availability. When the food intake or the child takes a food and it's not properly digested, for the body to now absorb the proper nutrients in that food becomes an issue. So these are some of the problems with unmodified cow's milk for the child. Now let's quickly run through complementary feeding. Now this will take us through the definition. When are we supposed to introduce it? Why do we need complementary feeding? How is it supposed to be done? How much are we supposed to give? What are the expectations? Then we'll compare homemade versus commercial made. Now, definition of complementary feeding. Complementary feeding makes a crucial contribution to a child's growth and development. So the simple definition, we have two coming from WHO and European Society for Paediatric Gastroenterology, Hepatology and Nutrition. WHO define it as any drink or food that complements breast milk, including milk substitute like infant formula or follow-up formula, in order to emphasize and encourage breastfeeding. Now, for Afghan, they define it as the expansion of the exclusive milk diet to include all solid and liquid food other than breast milk or milk substitute. So, in a simpler definition, complementary feeding is just a food to complement breast milk. Now, when we say complementary, the literal definition is that it should complement a breast milk and should not take the place of breast milk. So the child continued breastfeeding, but now we are introducing something else to help to meet up other nutritional requirements of the child at that stage, that the breast milk will no longer be sufficient. Okay, for WHO, they further divide the complementary food as transitional food and family food, which we'll discuss further. Okay, meanwhile, if you have any question, kindly drop it at the comment section while we are doing this presentation. If you have any question, drop at the comment section. Okay, when are we supposed to start this complementary feeding? Now, the two bodies we're also using for WHO is 6 months, while Afghan is telling us that it's 4 to 6 months. But to be honest, it's the mother that knows the right time to introduce the complementary food for the child. But from the age of 4 months, most of the organs and the GIT of the child has developed to the extent that it can take external food apart from breast milk. Just that you have to look at the constituents like the texture and the possible ingredients that should be introduced. But a mother should start watching out for complementary feeding signs from the child as from 4 months. So whenever any other food is introduced before the age of 17 weeks, which is the 4 months, earlier than 4 months, we will say that that is a wrong feeding pattern. As the first presenter rightly said, that exclusive breastfeeding should be only breast milk without any other thing, including water. So as from 4 months of age to that 6 months, the mother will be able to pick out the right time to start this complementary feeding. Most times, she will see some significant signs from the
Wisdom,
child,
are you?
but it's expected that before a complementary feeding can be introduced, it should be after 17 weeks, not later than that, which is 4 months. So complementary feeding begins when the infant is physically ready. I've said something about this, that from the 4 months of age, when you look at this graph, you can see that the gastrointestinal maturity starts from 4 to 6 months. The renal function, which is the kidney function, starts from that 6 months. The oral and fine motor skills, the same 4 to 6 months. Readiness starts from that same period. So whenever a mother notices some cues from the child at this stage, complementary feeding. Now, why do we need this complementary feeding? Why is adequate nutrition so important? Number one is that rapid growth requires nutrition food. So, on developmental milestone, we've talked about some things that is expected, even the growth of the child and the weight gain and others. So rapid growth, it requires high nutrition food. So the food should have adequate energy and nutrient density. So breast milk does not meet the energy, protein, iron, zinc, and some fat-soluble vitamins requirements after 6 months. So after 6 months, we expect this, that a mother introduces complementary food and it should have most of these nutrients that is no longer sufficient in breast milk. Now, there is also limited gastric capacity. Know the stomach size of a child is smaller than that of an adult, and the requirement, as I said earlier, is much in multiple portions than the one for adults. So there is need for us to plan their meals properly and give them the nutrient dense food because of this limited gastric capacity. We also expect fast growth and development at that stage. So high nutritional need for adequate growth and development, which for breast milk might not be able to give sufficient nutrient at that stage. Some nutrient like iron is not sufficient in breast milk at all, and we need to introduce that through complementary feeding. Now, why the small tummies, big nutrition is the main reason why we need to plan this very well. This try to show us how the stomach sizes increases till adulthood. You can see at that 4 to 6 months, what the stomach size can take is approximately 230 grams of food. And this child needs to meet up this plenty nutritional need of about 4 times, 3 times of that of an adult. So we also see another why complementary food is important for mouth motor skills. When you introduce complementary food to the child, it helps the child to develop mouth motor skills properly, tongue moving tongue forward and back, the tongue wave, and others. So the child can now start learning gradually how to move the tongue, how to bite food, and others. So even though at the early stage, the mom might be the primary feeder, which is around that 5, 6 months till about 9 months. The mom 10 going to 11 months, the mom might be the primary feeder. But you will notice that even for some children from that 8 months, they would have started trying to feed themselves. Then at that stage, the mother can be introducing food like picky food, whereby the child can easily pick and chew by himself. So from age of 11 months and beyond, you can see some children standing well to feed themselves gradually. So these are some of the importance of starting complementary feeding at the right time. Now, another why is age adapted textures and physical development. So adapted textures and physical sizes. As oral motor skill progresses, so does the ability to cope with different food textures. Meals with age adapted textures are important for safety reasons and for developing chewing skills, reduce the risk of rejection of textures through introduction of appropriate texture of food. So when you introduce a food at the right time, the texture of the food at the right time, it gives better room for the child to accept that complementary food. Okay, another one is that complementary food is important for test acceptance. So when you introduce early enough, the child can easily adapt to the test. So adapted tests we have as motor skills and taste develop, so should the meals. Gradual introduction of flavors and appearances. So if you introduce it at the right time, the child can easily adapt to this food, and the child can make preferences, because the same way we prefer some food than the other, that's the same thing that happens to children. But most times we get carried away and believe that their children, anything you give them, they can take. And that's why we have problem with these children accepting some of these complementary food when we want to introduce them to them. So we have some determinants affecting taste acceptance for these children. We have prenatal effects. Most times what the mom eats during pregnancy also have a way of contributing to the food that the child will like or accept as the child comes out. So increased variety also has a role to play. Repeated exposure, lower acceptance after age 1, modeling breastfeeding, inborn or some genetic factors. So these are some of the things that will affect the child. So the mother needs to eat right from the pregnancy period, that it also help this child to choose to accept healthy meals even at this stage of complementary feeding. And she needs to expose the child to different or varieties of food so that the child can pick, or you'll be able to pick the one that the child prefers at any given time. So how do we expect this breastfeeding complementary food to flow? Now we have a practical advice here that safety and hygiene is paramount. So optimal hygiene and storage is very important when we are dealing with complementary feeding. Food must be at the right temperature. Don't give the child the food that is too hot or too cold. So it depends on the type of the food you're giving to the child. So give the child the food with the right temperature. If it's a food that the best temperature is room temperature, please provide it to the child at that temperature. Don't make it too hot. If it's a food that needs to be hot, let it be hot enough, not providing to the child the other way around. So also a familiar flavor. So get flavor that is much familiar with the family, or something that you know that even you as a mother likes more during pregnancy. So you start with a familiar flavor and you progress it. Then you also start with small amounts of food on the spoon. This will give more chance for the child to accept that food than packing whole lot of food. Some children might want to touch the food and play with it and see how it is. Then you give them small amount first to see how the child accepts it. So don't pack whole lot of food. So how to start? As from that 6 months of age, you introduce one food at a time. Don't introduce so many food at the same time. If not, it will be difficult for you to know the one the child doesn't like or the one the child is reacting to. So you introduce one food at a time. You wait for 5 to 7 days before introduction of a new variety. So if you have different variants of that particular food, introduce one at a time, wait for some time, 5 to 7 days before introduce another one. Now you have to also consider age adapted textures and particle size. As from that 6 months, this baby has been used to just breast milk. So when you're bringing in a complementary food, it should be something that is close to the texture of the breast milk. So you can start with liquid food or semi-liquid diets for that child. Thank God we are all Nigerians and the common ones we have here is pap. So you can always make it in that form. There are so many other food you can introduce, even family food you can convert to also look like pap texture or something close to the breast milk texture so that the child can easily adapt to it at this very stage. But when the child is getting towards 8 months, you can start changing the consistency of the food. So the consistency or the texture of the food grows with the child. So you don't start one and continue with that. That's why a lot of children get to the age of 1, they will still not accept any other food apart from pap or those soft food because the mother never changed the texture with the child as the child is developing. So don't just start milk or a smooth food or you believe everything must be matched and you keep matching, and the child is getting to 9 months, you're still matching, 1 year, you're still matching. Definitely it will be difficult for the child to cope with normal family food. So you also have to avoid high amounts of nitrates in food. There are some food that are high in nitrates, something like spinach and beets. We also have some meat with nitrates. So we avoid all these high amounts of nitrate in food. If you're using protein sources, you use normal meat, fresh meat, not processed one to reduce this nitrate, or you go for fish either. Okay, how do we go about this? So respect your child rhythm and appetite. So don't just force the food to the child. Listen to the child, know what he or she wants at that particular time. If a child is crying or rejecting a food, there might be a reason for that, because that is their only way of communication to us. Most of them cannot talk the way we are talking. So the only way they communicate is either through cry or refusing food. So when a child is refusing food, try to know what the child wants at that particular time. It's not a time to force the child or tie the child to force the food, which is a lot of people practice it here in Nigeria, that one person can hold the leg, this one hold the hand, and they are forcing the child food. So if you look at this child, you can see the child is crying, but you will see she's stretching out hand for something. There might be something worrying her. She might need more water before the food. She might not want this food, and this should be respected. So feed slowly and patiently. Encourage children to eat, but do not force them. If the child refuses, try again, but never force the baby to swallow. Minimize distractions during meals. If the child loses interest easily, so whenever you notice the child is losing interest, you can minimize any form of distraction around the child. Don't overfeed the child, and also monitor the growth of that very child. So even if you notice that the child is eating well and the growth is not as expected, please check the ingredients or the nutrients you're adding to that food. Is it really adequate enough for that child? Good habit from the start may reduce the risk of emotional eating later in life. So these are some of the things we are trying to avoid. Some people will develop emotional eating later in life as a result of the way they were introduced to all this complementary feeding. Is that from complementary feeding, from there the child starts from transitional food to normal family food. So it's very, very key so that the emotional eating pattern of the child will not be affected. The acceptance in some infants is during 1 to 2 days. For others, it may take longer, up to a week, 8 to 10 trials. So you keep trying until you get it right for your child. How much of this complementary feeding should we give? Now, as from that 6 months, you introduce gradually. The child might not be able to take plenty, but we expect that you try it as the normal breakfast, lunch, and dinner. So try it in the morning, try it in the afternoon, try it at night, and also introduce snacks in between the main meals. So we expect 3 main meals for this child and 2 snacks in addition to breastfeeding. So the breastfeeding continues. At the breakfast time, you introduce a complementary food. During lunchtime, you introduce dinner, introduce. So the more you are introducing this, as the child is progressing and taking more, you be reducing the amount of milk so that the child will be blending gradually and from there flow into an intake of normal family food. So how much of this is needed? A healthy feeding relationship happens when parents and the children share responsibility. So feeding on demand, you can see this child, she's taking the food appropriately. So this is feeding on demand. You can see that the child needs the food. So she opens the mouth and takes the food, and not the other way around, crying and others. So the child decides whether to eat and how much. There are some children that might not take much, and maybe you have to reduce the number of hours. Instead of giving them only 3 times, you might have to give the child up to 4 or 5 times. Maybe you are using 3 hours interval because the child is not taking much at a time. So you need to understand your child and now know the best technique to use for that child. Now, parents respond early and appropriately to hunger and satiety cues. So when the child gives you some hunger cues like crying, flaring arms and legs, opening mouth and moving forward for spoons, the mother should be able to understand and provide the necessary food. Then when a child also show you some satiety cues like falling asleep, becoming fuzzy, slowing down, stopping to suck or take the spoon, or refusing the spoon or nipple, please know that the child is okay. You can stop at that point. So go into the what. Complementary food introduce variety. So when we say complementary food, you introduce varieties of food into the diet of the child. Let's start with the red color. We have here red having meats and fish, milk, egg. These are high quality animal proteins, and they are good sources of highly available iron. So the heme iron, you see it in all this food, and it's very necessary when preparing complementary feeding. You can as well introduce baby juices and water, which provide the essential, which is also essential for proper digestion of food. We have oil can come in, maybe Cerelac oil, all those cereals oil can come in. All these cereals oil can be corn oil, can be peanut oil. We encourage mothers to introduce peanuts, maybe blended peanuts at that time, because the oil is very healthy and it's energy dense that can help the child. Then fruits and vegetable can also come in to provide vitamins and minerals, and also help the child intestinal transit, so avoiding constipation So it will help the child to go to toilet as expected. Start with simple texture test adapted but low allergenic food. So at that 6 months, we have some common food you can bring in. You can bring in rice, you can bring in roots like potatoes, yams, carrots, and you can bring in fruits like pears, bananas, apples, avocados into your food. So this time there is still developmental readiness to discover new food. You avoid food high in nitrate as we discussed earlier, and you introduce new food one at a time with the right taste and texture. Then from 6 to 8 months of age, we can now start introducing gradually some of these food with allergens, something like soya and eggs. So you start gradually. So at these 6 months, you can do egg yolk, but from 8 months, you can start gradually with the white, because a lot of children develop egg white allergy. So some of these allergens food from 8 months, you start gradually introducing it to the child. So from 1 year of age, which is 6 months, we are looking at the complementary food for them, which is toddlers from 1 year to 3 years. So they are not simply little adults. Actually, toddlers, they have very specific nutritional requirements. So when the child is 1 year of age, it's not a time to start buying fizzy drinks that is non-nutritive. Fizzy drinks, I don't want to call names anyway, but we know all these common drinks around that parents keep buying for their children. It's not a time to start it, but this is a time to still continue milk, because milk remains an important part of the diet. You give the child the right snacks at this very time. You can see the snack of this child. We have banana for this child, which is very, very good. It has good vitamins, minerals, and it also gives good energy for the child. It's also a time to expose the child to small, regular, nutritious, and nutrient-dense meals. So ensure that you give the child the right meals at that point in time, and you can introduce almost even all the foods you know that used to be allergens before, like the soya, the eggs, no wahala. But the only thing you have to still hold on is the peanuts. The peanut itself should not be given to a child till 3 years of age, so that the child can control the movement of the nuts. But unless it's grinded, so if the peanut is grinded, you can grind it and add to the food. But to give it to a child as a snack, a nut snack, it has to be after 3 years of age. Now we have key concerns for infant and toddlers issue: lack of essential nutrients, too much protein, too much sugar, and calcium intake marginal, and too little fat. Which complementary food, if properly planned, can clear all these issues, because by the time you introduce the right diet, we will have essential nutrients and the protein intake given the right portion. In fact, most times the child might not even finish the whole one portion of either fish or meat. So you start gradually and you progress. Then you don't put sugars in all these complementary food until the child is 1 year of age, but you start a little. You don't just pack sugars into the baby food like that. As we said earlier, that milk should not be overemphasized, so the baby food should still have milk to help supply sufficient calcium, and healthy fats from peanuts and probably fish fats can be introduced. Now we'll compare the homemade and commercial complementary feeding. At times, some people says they prefer homemade, some say they prefer commercial. Let's look at the two together. Some advantages of home prepared complementary food includes that it can be fresh and unprocessed. So you have your child eating from the kitchen prepared meal. So you get it fresh, not processed, is culturally accepted and easily available. So you can easily do it from the normal family food. Somebody preparing rice for the entire family can prepare a complementary food from that very rice, or from beans, or from the potato you're cooking for the family, or from the yam for that child. It can be ground, pureed, or sieved for proper consistency. So that's one interesting thing about homemade food. You prepare to the best texture, and it's more economical because it's not that expensive. You get it from the normal family food. You can get variety. So any food you are cooking in the house, you can just make complementary food from that. It's just getting the right nutrients. So we have some of the disadvantages that sometimes it look as if that's what is discouraging the mothers, that is maybe inappropriate or poor quality, which if the mom take good care of hand hygiene and others, this will be taken care of. It may be inadequate energy density. That's if the mother is diluted so much. So the right consistency is very important to clear this. It has greater potential of contamination, time consuming, and potential contamination from chemicals around. But actually, most of these disadvantages is something that the mom can easily take care of in terms of the personal hygiene and preparation of the food. So we have some advantages of commercial food that's most mothers say is easy to use, it's readily available, you can carry it all around, these hygienic conditions. But actually, if personal hygiene is not properly followed, that might also be a problem, because this commercial complementary food can as well be expensive, and the ingredients, they are not locally available. So we have some of the food that are high in some of these key nutrients, calcium, iron. So we have some of the common food we have around. We have milk to give us calcium. We have cowpeas, which is the common beans we cook around, to give us. We can also add sesame leaves in our food. We also have the ones that are high in iron. You get it from animals, and some plant sources like bay leaf, mint seed. We also have vitamin C's coming from citrus fruits and others like guava, to take care of vitamin C. And B12, we can get it from liver and beef liver and lamb liver, even chicken liver. You see all these things there. We have zinc coming from wheat, melon, and others. We have carotene, which is vitamin A, coming from carrots and palm oil. So in summary, we say that exclusive breastfeeding between 4 to 6 months is the key. Breast milk contains all vital nutrients your baby needs for the first 4 to 6 months of life. Between 4 to 6 months is time for complementary feeding. After 4 to 6 months, your baby needs more nutrients. Breast milk alone is no longer enough. Complementary food must contain all important nutrients, especially iron, which is not sufficient. Iron is the most important nutrient after 6 months. It's important for blood formation, for brain development, for immunity, and vitamin C helps in iron function and absorption in the body. Good sources of iron include fish, meat, green vegetables, and hygiene. Hand washing is very, very important while preparing complementary food. Thank you very much for your time. Oh, wow.
Wow. Such an expository time. Thank you so much, Mrs. Amarachi Igboanugo, our dietitian and clinical nutritionist here at Lilly Hospitals Limited, for doing justice to that discourse. I believe that everyone here who is listening to her or who have listened to her, and then the other speaker, would have grabbed a lot from this webinar session. Thank you once again, our facilitators, for putting together that impactful session. Thank you so much. So quickly, we'll go into taking questions from the discussion. But before we do, whilst we are expecting to have your messages sent into our chat box, whilst we're expecting to have your messages dropped in our chat box, we would quickly take on a few that has been sent in earlier. We're going to quickly take in a few that has been sent in earlier. And I'll quickly take the questions, and we'll have our great facilitators do justice to them. So quickly, okay, I'm seeing one. Yeah, someone is asking a question here. All right, we have 2 questions dropped here already. We will take them, but can I please quickly take the ones that has been sent in earlier? So someone is asking, maybe this will be directed to Mrs. Sanusi Oluwaseun. Someone is asking, please, how can I make my nipples pointed for easy breastfeeding? I had issues with my first baby lashing on the breast as I have flat nipple. So okay, can this be attended to quickly, ma'am?
We've talked about that presentation. That's why I showed a picture for people that have inverted nipple. During pregnancy, you'll have been using your hand to try to bring out the nipple. Maybe after giving birth, the nipple is still not out. The nurses in ORG or the pediatric team can visit you. Then we use syringe to try to bring it out. I show the pictures that time. I'll use a syringe. You will cut the end of the syringe, then put it to your flat nipple, then use the plunger to try to withdraw it out. By doing that, the nipple will come out so that you can be able to breastfeed your baby.
I hope that was gotten. Whoever that has asked that question, I hope that response was gotten. Okay, very quickly, someone is also asking, what can you take to improve breast milk production? And we'll do it a 2-in-1 question. And can exclusive breastfeeding be done for twins? Okay, so quickly.
Exclusive breastfeeding can be done for twins. The mother will just have to be well hydrated, taking enough of water, at least 4 liters a day. They're eating very well, not just eating like 2 or 3 times in a day. It has to be eating consistently. So, but as you are eating, you are producing more so that you'll be able to give the baby's breast milk. So those are the things you can do to improve your breast milk being flowing. And the more you put baby to breast, the more the breast milk will. You have to eat well, adequate and balanced diet very well so that you can be able to breastfeed.
Oh, thank you so much for that response. So someone is asking, why is it that some nursing mothers don't lactate? And also from another person, how can you treat sore nipples? Nurse, please.
Sore nipple is as a result of your baby not latching well. That means your position is not very good. If you position your baby very well, sore nipple. So it's due to baby latching only the nipple. That's what causes the sore nipple. So you have to position your baby very well, as we have explained during the presentation. With that, we have a sore nipple.
I hope that was well taken. All right, we'll take this another one very quickly. How can the immunity of the child whose immunity is low be improved? And also, how do a patient with HIV breastfeed? Nurse, please, once again.
Yes, patients with HIV breastfeed their baby. But you have to stick with that you breastfeed baby. If you are choosing to breastfeed, that means you do only breastfeeding for the 6 months of life without complementary feed. Because if you are mixing the feed, so that if you use only breast milk throughout the 6 months of life, there won't be any issue. The virus will not be transferred to the baby.
Okay, maybe we'll take this next one. Mrs. Amarachi Igboanugo will help us take this one before we go back to the others that we have on the list. Someone is asking here concerning the meat and vegetables. How will I prepare for easy consumption from the age of 6 months?
Okay, concerning the meat and vegetables, from the age of 6 months, you just prepare and store in a good fridge or freezers. That's the only way to preserve if you have to. If not, if you remember some of the advantages of homemade complementary food is made fresh. It's something you can do on daily basis. But if you have to store, then there will be a good freezer or a fridge around to store the meat and vegetables, so you can store at the right temperature.
All right, I hope that was gotten. Thank you so much, ma'am. Thank you. So we have another that will go to Mrs. Sanusi Oluwaseun, our pediatric nurse here at Lily Hospitals. So the person is asking, how do one wean a child off breast? And also, I have someone who has complained she wasn't lactating despite using breast pump. Can you please give counsel and advice?
Okay, about weaning off a child, according to WHO, you should start that weaning after 2 years of life. As my colleague have explained earlier, during 6 months to 2 years of life, we have started a complementary feeding. So it will be like a gradual process, not taking off the baby breast milk once. So once you've introduced, just be reducing the rate at which you are breastfeeding the child gradually till you will stop completely. For example, now you started giving the baby complementary feed from 6 months, but after 2 years is when you start weaning. So as you are giving, maybe you can reduce it once in during the day, maybe at night once or twice. Then later, maybe for a week. After some weeks again, you try to reduce it gradually so that baby will wean off out of the breast milk.
All right. So maybe okay, we'll take this one. What type of milk, nurse, do you give a baby from 6 months? So once we take this, we're going to, yeah, we can see you, Sophia. We can see you. Once we're done taking this question, we're going to take yours. Thank you.
About the type of milk to give to baby after, so you give baby follow-up milk, which will not depend on the products you want to get. I can't be mentioning products here.
Okay, can you please take that again?
Type of milk to give to your baby from 6 months.
months.
You give them follow-up milk, which is infant formula that will be 0 to a year that you can get. It now depends on you the products you want to use for your child.
And it should be also affordable. So you do something that you can afford and that you can keep at for the period of time that the baby will be taking in, that food. Okay, so we would. I have Sophia here raising her hands. Sophia Odanose, please, can we have you speak now? You can go ahead asking your questions. Hello, Sophia. Please unmute and ask your question. Okay, we can't have you do that now. We'll quickly hear out another question. Okay, one of our participants is saying again that this has not been answered. Okay, I have someone who complained she wasn't lactating despite using breast pump. So, nurse, what would you advise such a one?
Despite using breast pump doesn't mean that. It's just to bring the breast out of your breast milk from your breast. So what you do is that you put baby more to breast. As I said earlier, that what controls the breast milk flow is hormonal stimulation as a result of your baby sucking well. So once the hormones are released, the more your baby is sucking, the more the flow of the breast milk will be. So you have to be putting your baby to breast. You feed baby on the normal timing. When baby needs it, you put baby and be hydrated, eating very well, so breast milk will come.
Okay, thank you so much, Nurse. So for Ruth, I can see your question here. We would appreciate it if you can share with us the list of food to start with during complementary feeding and the appropriate combination, as getting the right combo can sometimes be challenging. I don't know how we're going to pass this on to you, but we would, um, okay, yes. Yes, Mrs. Amarachi is going to just put in something to this and maybe we'll leave you a message on the chat box. Thank you.
Okay, come with the person again.
Okay, so she's saying that she would appreciate if we can share with her the list of food to start with during complementary feeding and the appropriate combination, as getting the right combo can sometimes be challenging. So please, ma, kindly advise.
Okay, for complementary feeding, you can start with the common food around. Let me give an instance. When you want to prepare a balanced diet for that child, you start with a carbohydrate base. So it can be a cereal base. You can choose rice, for instance, or you can choose maize, or you can choose potato, for instance. That stands as our carbohydrate. Then a protein will come in. Remember, we say it's either meat, fish, milk, or egg. So let's say I'm choosing fish. I'll go for oily fish. It's still part of family food. So I'm taking rice. I'm taking fish from this same family food, and I need a vegetable. Now remember we mentioned carrot as a good source of vitamin A. It's also a vegetable, so carrots can come in now, and I can do justice to these three depending on the age of the child. Then I will determine the texture. So if it's still at the 6 months of age, whereby the child is just used to smooth texture, I might need to blend this rice, carrots, and fish to be very smooth so that the child can still feel it the same way the child feels breast milk. So it's going to be very smooth. And I can as well give the child a juice, something like orange can be squeezed, banana can be mashed. So these are some of the combinations that we can do. So it depends on the age of the child, what is available in the house, and what the family can afford. Thank you.
All right, thank you so much, Mrs. Amarachi. Thank you, thank you. So is Sophia ready to speak now?
Yes, ma'am.
Great, great. Can we have you please speak? Thank you.
Right. Hey, everyone. Thank you so much for the presentation. It was really helpful. And I have contribution and question. I don't know if there's room for that.
Yes, please, you can go on. Thank you. We'll make it very concise.
So,
Thank you.
okay, no problem. Then for the contribution I have is about the inverted nipple. So I want everyone on this platform to actually know that it's actually what they presented today is just like that, not like they added anything to make it sweeter or whatever. Inverted nipple can actually, you can actually do something to make it pointed out. Like just as the nurse explained, is with syringe, and have experienced it. So I actually started when I was pregnant. Like I was about, I think, 7 to 8 months old pregnancy then. So I have to just start it. I cut the syringe myself, and then I started dragging it out. It's painful, but if you know what you are going to get at the end of the day, that even before you put to bed, your milk starts to lactate. You will just do it, bear the pain, and do the needful, and at the end of the day, you'll be the one to enjoy it. That's just my contribution. Then the question I want to ask is this: if you, for instance, I want to make pap for a baby, maybe like from 6 months old, do I need to add sugar or not? Or maybe I can just put any sweetener now. So I want you to throw more light on that. The second thing, the position of breastfeeding. The first picture you showed, the woman, though the head of the baby is on the being between the elbow of the woman, the first hand is positioned very well. The hand, the palm of the hand is on the baby's buttocks. Then I saw the second hand supporting the baby's head also. So is it advisable to do that, or the second hand should be used at least to support the breast? Most especially for those that have big breasts, so that at the end of the day, it won't cover the baby's nose. So I actually had some confusion in that aspect. So I just want you to throw more light on that. If we need to support the breast, at least as the baby is suckling, then support or not. Thank you.
Thank you so much for bringing that contribution in and then for your question asked. So I would have Mrs. Amarachi and then Mrs. Sanusi attend to both concerns now. Thank you.
Thank you very much. For the milk, for the pap aspect, you don't add any sugar, no honey until 1 year. So when you prepare a pap for a child, an infant, so you know when we say infant is less than 1 year. So during infancy, before the age of 1 year, you don't add any sweetener, no sugar, no honey. Just prepare the pap and add milk or any other thing you want to use to fortify it, whether egg yolk or probably a fruit like banana you can add to it. No problem. If you want to sweeten it, you can use banana to sweeten, but don't add sugar, don't add honey. Thank you.
Okay.
Okay, about the breastfeeding position, you can use your hand to support the breast in case your breast is too big that to cover the baby's neck. You can use your hand to support.
All right. I trust that that's been properly attended to.
Yes, thank you.
Thank you, ma'am. Thank you. You can mute your mic, please. Thank you. Okay, so Dr. Igboanugo wants to say thank you. I can see you're doing justice to some of the concerns that have been put here. Thank you for that support. We are grateful. So to bring this to a wrap, I want to enjoin everyone to please join our Lily webinar group. We have it on WhatsApp. Kindly join in. We're going to be bringing much more informative webinar sessions like this. It will profit you and it will do you a lot of good if you can join us there. So when you join us, you'll be getting up-to-date information on webinar sessions that will be coming up. Okay. Also, you would find the recording of this session and further questions that you would want to put in there can also be dropped there. We would attend to them. You would also find the recorded session, the recording of this session dropped there as well. So you can listen to it and then reiterate and then be reminded of all that was talked about. Once again, this is the Lily Hospitals Limited presentation put together, and want to thank everyone who's been a part of this. We cannot appreciate or thank enough our two facilitators, Mrs. Amarachi and Mrs. Sanusi. They are one of us here at Lily Hospitals Limited. Thank you for joining us in this session. We also want to thank Mr. Rutherford and the ICT team for helping to ensure that we had a smooth run today. Thank you so much. And to the Lily Group, thank you for bringing such sessions to the public. We appreciate the effort. Thank you. We can see that more questions are coming in. They'll be attended to after now. Thank you once again. Thank you. So we'll call this a wrap. Thank you. Please look out for more sessions like this because they will be coming in. Thank you.